Now we're turning to the second half of our webinar where we'll be looking at two specific case studies. We will be presenting you two videos back to back. And I've noticed that our colleagues from India and the US are on the call as well, so they will be looking at the chat if you do have any question in the meantime. So the first video is from Dairy Council of California, which is a nutrition education organization and is comprised of registered dietitian and nutrition and communication expert who work directly with educators, food service professionals, health and wellness provider, and community leaders to provide training, support and nutrition education resource to teach the importance of nutrition and how to eat healthfully. These collective efforts educate millions in California and throughout the United States every year. We'll hear more about the school meal program supported by the Dairy Council of California and how they manage to reach out to children even in times of the COVID-19. The second video is from the National Dairy Development Board from India, which was created in 1965 to promote, finance, and support producer-owned and controlled organization. NDBB program and activity seek to strengthen farmer-owned institutions and support national policies that are favorable to the growth of such institutions. NDDB efforts transform India's rural economy by making dairy a viable and profitable economic activity for millions of milk producers while addressing the country's need for self-sufficiency in milk production. India being home of one of the second largest population in the world, we are excited to hear more about the different programs and how they ensure Indian children have access to dairy nutritious food. So let's start the video.
Hello, and thank you for joining us. I'm Tammy Anderson-Wise, CEO of the Dairy Council of California. Thank you, IDF, for providing Dairy Council of California the opportunity to share some of our experiences with school milk programs. We're excited to be part of the 2020 edition of the School Milk Programs Report and strongly believe in the value and need for milk programs in schools. Today, we are going to share with you insights into California's school meal program, which include milk as a key component, how school meal services adapted during the COVID-19 pandemic, and why milk is so critical to supporting children's health, growth, and development. To begin, Dairy Council of California is a nutrition education organization who has elevated the health of children and families and communities through nutrition education and technical assistance on behalf of California dairy farmers and processors for over a century. We're proud to be part of the dairy community, partnering with health, food service, and educational professionals to teach nutrition and how to build healthy eating patterns to ultimately elevate the health of children and families. We believe that milk and dairy foods are a vital part of healthy eating and healthy eating patterns and a solution to good health. That is why we support food access programs that provide essential nourishment like federal school meal programs. Milk is an important part of school meal programs, providing students with essential nutrients that are typically underconsumed in the American diet. Students who consume milk and dairy foods as part of daily eating patterns are supported for optimal growth and development, academic success, and positive health outcomes. Dairy foods offer health benefits that are different from plant-based or other animal-sourced foods, playing an integral role in supporting overall health. That is why we believe milk and dairy foods are an essential component of healthy dietary patterns for children and all people across the lifespan. For millions of children in the United States, school isn't just a place to learn, but a place where they can depend on receiving healthy meals. Each year, federal school meal programs, which include milk and dairy foods, serve 4.9 billion lunches and 2.45 billion breakfasts, with the vast majority of students coming from low-income households and relying on school meals for nourishment. In addition to supporting food access programs like federal meal programs, we provide educators and key gatekeepers with nutrition education resources to teach children and families how to make healthier eating choices, which include milk and dairy foods, and empower them with both the knowledge and ability to build healthy eating habits for lifelong health.
Hi, my name is Shannon Young, and I'm a registered dietitian nutritionist and the Food Systems and Access Program Director for the Dairy Council of California. As Tammy shared, milk is an important part of American school meal programs, providing students with essential nutrients that are typically underconsumed in the American diet. In the U.S., federal meal programs are considered a public health program. The National School Lunch Program is a long-standing program that has nourished school-aged children for 74 years. All our federally funded programs, including school meals, must follow the U.S. Dietary Guidelines for Americans, which defines healthy eating patterns. Designed to meet nutritional needs of the average child, school meal programs help to ensure school-aged children have access to the healthful foods they need to meet 1/3 of their nutritional needs for lunch and 1/4 of their nutritional needs for breakfast. While milk is an essential part of school meals, schools are required to offer low-fat plain, non-fat plain, or non-fat chocolate milk options. Full-fat milk is not allowed in the federal school meal programs. Tammy shared that in the U.S., schools serve 4.9 billion lunches and almost 2.5 billion breakfasts each year. Of that number, more than 30 million students depend on free or reduced price lunch, and more than 14 million depend on free or reduced price breakfasts, making school meals, which includes milk as an essential component, a key access point and a vital safety net for children who live in low-income and/or food-insecure homes. In California alone, we have 6.2 million students who attend public schools, and over 60% of them live in low-income households. In fact, most of our low-income students qualify for free school meals. Over 540 million lunches are served in 10,000 schools per year throughout California. And these figures are before the COVID-19 crisis in the United States. Before the pandemic crisis, food insecurity in the U.S. was at the lowest point seen before the Great Recession in 2007 to 2009. The current crisis is likely to reverse the improvements that have occurred over the past decade. Nationally, it is estimated that more than 54 million people, including 18 million children, may experience food insecurity because of the crisis, resulting in an increased reliance on our national school meal programs. In March of this year, the pandemic forced schools across the U.S. to close and transition students to online learning from their homes. Understanding the important role school meals play in nourishing children, the U.S. government provided a waiver via summer meals to enable school food service to provide free school breakfast and lunches to all children 18 years and younger. Each of these meals include a serving of milk. School food service programs were required to close their cafeterias, shifting from serving hot meals to distributing cold, prepackaged, or bulk meals in boxes or bags. Many schools are limiting the number of days they distribute meals and provide breakfast, lunch, and sometimes a supper all in one box that parents pick up and take home for their kids to eat. This has created challenges for milk service. With 8 ounces of milk being required with each meal, many school food service have shifted from single serving sizes to providing half-gallon or gallons of milk with meal distribution. Keeping milk and other refrigerated items cold during pickup has created food safety challenges due to the lack of refrigeration. As a result, there is a high need for large insulated cooler bags that hold a crate of milk. We are even seeing schools leasing refrigerated trucks to meet the increased cold food storage demands. As all meals need to be kept refrigerated during distributions for family to heat and serve the meals in their homes. Many schools are trying to purchase ultra-high temperature treated milk because it does not require refrigeration. However, this type of milk is not produced in the volume needed to meet the demand at this time and is often cost prohibitive. The response and support to provide food access through schools across all levels was great and inspiring, but it didn't happen overnight. When schools and school cafeterias were forced to close their doors, creating confusion as millions of students, families, and communities throughout California were left wondering how children who rely on school meals were going to get fed. With the environment changing so rapidly, there wasn't an easy way to find locations serving free school meals. This is why Dairy Council of California partnered with California Milk Processors Board to support all California families and school communities by designing a dedicated landing page to act as a hub for students, parents, educators, and the school community looking for schools providing free school meals. To share this valuable information, we launched a statewide public awareness campaign, partnering with influencers, local, regional, and statewide organizations, and the school community, as well as leveraging social media, digital advertising, local media, and outdoor placements, including billboards with information on how to access free school meals located near their homes. This effort was highly successful, and the landing page was a valued resource for California schools and communities, supporting over 500,000 site visits and helping millions of meals get served. We believe helping to ensure children and their families have access to healthy foods provided by school meals, which include milk and dairy foods, is critical to building healthier communities, which is why it is such a high priority for us. It is also an opportunity for the dairy community to show our support for community health at a time of great need. The new school year has begun here in the U.S., and the pandemic continues to disrupt school operations. Many schools have started the year with distance learning. School meal services opened with drive-through meal distribution, but schools across the nation saw a deep reduction in meal participation when they were required to resume the National School Lunch Program regulations. In response to the demand for increased food access, the continuation of free school meals for all students has been approved by the U.S. government through December 2020 or until the funding runs out. This is great news, providing needed nutrition for kids and enabling them to access milk during this time.
Hello, my name is Ashley Rosales. I'm a registered dietitian nutritionist and the Program Director of Nutrition Science at Dairy Council of California. Nutrition and access to food play an important role in protecting the health of people across the lifespan. And this is especially true for children. Supporting the optimal health of children means ensuring they are able to obtain the nutritious foods needed for proper growth and development, while also setting a strong foundation for learning and lifelong success. We know children are facing serious health issues. Childhood obesity rates remain high in the United States, and globally, young people are at greater risk for developing serious health conditions, including high blood pressure, type 2 diabetes, heart disease, and asthma. And although many children are currently overweight, they are also undernourished, especially within vulnerable communities. Access to nutritious and wholesome foods, which include milk and dairy foods, fruits, vegetables, whole grains, and high-quality plant and animal protein sources, is essential to help children grow healthfully and reach their full potential. Milk and dairy foods play an important role in improving diet quality of children and adults. Poor diets are a leading cause of illness in the United States, contributing to approximately 500,000 deaths per year related to chronic diseases such as heart disease, diabetes, and cancer. The decline in milk consumption in children warrants concern for decreased diet quality and nutritional inadequacy. Experts agree that school feeding programs have a positive effect on child and adolescent nutrition and health outcomes. For example, research suggests that eating school breakfast every day is associated with healthier dietary intake among United States school children. And consuming vegetables, fruit, and dairy foods through school meal programs is linked with improved academic success and health among children. Research also shows that what children drink can have a big impact on their health, as beverages make a significant contribution to overall dietary intake. United States representative data confirm that beverage consumption patterns of young children diverge from current recommendations, contributing to excess calories from added sugars in children's diets. And what's more, there are significant disparities in sugar-sweetened beverage intakes across ethnic groups and income levels. Childhood is an optimal time to develop lifelong healthy eating and beverage habits. And consumption of milk during childhood has lasting impacts on health. Young children who do not meet the daily recommended servings of dairy milk, yogurt, or cheese may have inadequate intake of important nutrients such as calcium, vitamin D, and potassium. Nutrients of concern identified in the most recent 2020 Dietary Guidelines for Americans Advisory Committee report. While there is more than one way to meet dietary needs for individual nutrients such as calcium and protein, the amount and the variety of food that must be consumed to match the nutrient package and affordability provided by dairy milk may be difficult to achieve for many children, especially those who are experiencing food insecurity. Where families and children live, learn, work, and play can have a great impact on the food and beverage choices made available to them. Many children and their families rely on the critical safety nets provided through federal nutrition assistance programs, such as the United States National School Lunch Program, the School Breakfast Program, and many others. Participants in these school meal programs consume more milk than those who do not participate. Milk and dairy foods play an important role in healthy eating patterns across the lifespan. So, forming milk consumption habits during school-age years is critical to promoting lifelong health.
Good morning and namaste to everyone. It's a pleasure to join all of you in this important virtual seminar for launch of the second edition of IDF's Bulletin on School Milk Programs. Today also happens to be the World School Milk Day. That makes it all the more special. I'm also happy that IDF has shown interest in learning about school milk programs of India. Before I take you through the details of the school milk programs in our country, I would request our chairman, National Dairy Development Board, Sri Dilip Rath, for his remarks on this important occasion.
I am happy to join all of you on the launch of the second edition of International Dairy Federation's Bulletin on School Milk Program. As we all know, milk is a complete food and a vital constituent of a balanced diet. It is rich in various macro and micronutrients like protein, vitamins, and various minerals which are essential for maintaining good health. Numerous studies have shown that regular milk consumption by children improves their health, cognitive parameters, and reduces nutritional deficiencies. Children are the future of our world, and proper nutrition is vital for their healthy development. Nelson Mandela had once famously said, and I quote, "There can be no keener revelation of a society's soul than the way in which it treats its children," unquote. Although India has abundant availability of milk and food grains, malnutrition, especially amongst children, continues to be a major health concern. National Dairy Development Board, India, has been promoting introduction of school milk program as a conscious measure to improve child nutrition on the one hand, and to provide market access to millions of our small dairy farmers on the other. With an aim to address malnutrition, NDDB has established NDDB Foundation for Nutrition, NFN, for providing milk to school children. NFN, in partnership with various public institutions, corporates, and dairy cooperatives, would continue to use milk as a tool to address malnutrition, to ensure a better future of our children and our nation. As part of our nutrition initiative, NDDB is celebrating National Nutrition Month in September every year to spread the message of nutrition throughout the country. Thank you.
Welcome back again. I thank Chairman NDDB for his remarks, and as he said, school milk programs means investing in future of India. Before I develop on the school milk programs of our country, let us have a brief overview of India. India is a home to 1.3 billion people, about 18% of the world's population, which is living in only 2.5% of the world's land area. And 472 million children under the age of 18 years, it's about 40% of the total population. And we have students which are enrolled from 6 to 15 years of about 240 million. So you can say that India is fairly a young country. Malnutrition in India is very prevalent. Stunting, wasting or severe wasting, underweight, these are the prominent markers of malnutrition. And as you can see from the graph, malnutrition among children under 5 in India has significantly declined over the past decade. However, as a country, we need to keep making continuous efforts to accelerate improvements towards ensuring health and well-being of our children. The malnutrition in the country, to address this issue, we have a multidimensional approach, and the government is also, addressing this problem through this multidimensional approach. The various schemes which Government of India has launched for curbing this malnutrition are Pradhan Mantri Matru Vandana Yojana, which involves a direct cash transfer of about 6,000 rupees to the pregnant woman. We also have a scheme called Poshan Abhiyan, which aims to reduce the stunting, undernutrition, anemia and low birth weight in babies for better monitoring and improved community mobilization. We also have a National Food Security Act, which makes food accessible to everyone, and the nutritional security for the most vulnerable class of our people is addressed, making access to food as a legal right. We also have a scheme addressing these school milk children in way of midday meal schemes. The program supplies free lunches on all working days to children in both primary and upper primary classes in the government schools. So if you closely look at the sustainable development goals, all these schemes which I told, they have a significant role to play in attaining zero hunger or good health and well-being, thus heading towards again achieving global nutrition targets by 2030. Reaching children through milk via different schemes is, as you can see, one of the important focused area for our country. The lack of adequate nutrition can create long-lasting and very often permanent physiological changes in the children. Therefore, meeting these nutritional needs in early growth years becomes very important. Recognizing the contribution of milk in improving the nutritional status in our children, the government has developed policies and programs to promote milk consumption at this formative age. The various state level initiatives for distribution of milk and milk products to children under 5 years through Anganwadis, which is the rural child care centers. We also have distribution of milk through the midday meal scheme, which I told earlier, and it is perhaps the world's largest school milk program. We also have initiatives such as gift milk programs, which is being carried out by NDDB. It works as hand in hand in the various government programs through channelizing the CSR allocations. If we see the milk consumption versus availability in our country, first let me focus on our journey on the dairy sector. It's a remarkable journey. We have spent more than 5 decades and the relentless efforts which have been put by both the government and NDDB in the form of programs like Operation Flood, then the Perspective Plan, and now National Dairy Plan. It has led to the nutritional self-reliance. Currently, if we see the per capita milk availability, it is about 415 grams, which is higher than the RDA recommended by ICMR, which is close to 300 grams per day. So while the availability of milk has increased in our country, the capacity has been translated into an increase in the consumption of milk among all population classes equally. If we see the bottom half, total population in monthly per capita expenditure classes, it accounts for 30% of the total liquid milk consumed, both in urban and rural areas. Whereas the top 20% population of MPCE consumes about 1/3 of total quantity of liquid milk, both in rural as well as urban areas. So, which means that higher income groups generally consume more milk, and lower income groups, they consume less milk in terms of the quantity. So all the safety net programs which we are talking, like school milk programs, are necessary to make available milk to the weaker socio-economic section of our population. Let me focus now on the school milk programs in India. Various states like Gujarat, Haryana, Kerala, Madhya Pradesh and Rajasthan, they have initiated regular school milk programs in our country. Together, more than 15 million children across around 30,000 schools have been reached through all these interventions. The milk supply is coordinated with the help of state and the district level milk cooperatives and federations, and different variants of milk like fortified pasteurized milk or the sterilized milk or flavored milk which is fortified with vitamins or the sweetened milk powder, as per the individual policy of the states, is being supplied in the schools. And under the major school milk programs in India, if you see, Gujarat covers about close to 1 million children, Haryana about 500,000, Karnataka 6 million, MP also covers about 5 million, and Rajasthan again about 6 million children. All these states, they target the age group of 6 to 14 years, I think only with the exception of Madhya Pradesh where the target group is 6 to 10 years. So the different states have different models of providing milk or milk products either on all working days or alternatively on alternate working days. The milk supply initiatives by our state government, apart from school milk programs, they have also taken initiatives to supply milk and milk products to children in Anganwadis, which I told earlier, there are the rural child care centers. Moreover, a product like sweet kheer, which is a type of pudding which is fortified bal mutham, mix of wheat, split chickpeas, milk powder, oil, because we also need the fat source, and sugar, they are also provided to children in some of the states. Now let me focus on the gift milk program which NDDB initiated. National Dairy Development Board, during its Golden Jubilee year in 2015 and 16, established the NDDB Foundation of Nutrition, which is commonly known as NFN, keeping the objectives of improving malnutritional indices of our children in mind. Its mission is a glass of milk for every child. With special, it has a special focus on the girl children, and it is our firm belief that a stronger child means a stronger country. NFN's mandate is to distribute various flavors of 200 ml of flavored milk, which is fortified with vitamin A and D, for the government school children in the age group of maybe 5 to 15 years on all school working days under the CSR assistance of various public sector units and the corporates. NFN only acts as a licensing agent, so there are donors under the CSR programs. The dairy cooperatives and producer companies, they are our partners for supplying milk or milk products, and the schools are also our partner for proper implementation of the program. Since inception, NFN has covered around 60,000 students which are studying in more than 150 government schools under the CSR assistance. Let me say that out of these beneficiaries, almost 50% of them are the girls, and NFN has served more than 8.5 million child milk days, throughout the year. The child milk days is one child getting a glass of milk every day. Then let us see the impact of the gift milk program, which was initiated by NFN. We have encouraging results from under the program. I would like to share the impact results of one of our program which we implemented in Latehar district in the state of Jharkhand. The study was conducted by the Rajendra Institute of Medical Sciences at Ranchi. It was planned in 4 phases. So we started with a baseline assessment to understand the socioeconomic and nutritional status of the children before we implement the program. Then we have interventional phase where we provided 200 ml of flavored pasteurized stone milk fortified with vitamin A and D, and it was distributed to the school children. And then we have a first impact study after 1 year of the milk distribution to understand the effect of regular milk consumption on the children. We again carried out impact study 2 after distribution of milk for 2 successive years to understand the sustained benefits of regular milk consumption for 2 years. The study was carried out to understand the impact of milk consumption on various aspects of some following domains of study, like socio-demographic profile, what is the milk consumption habits, the health profile including anthropometry and biochemical investigation, and also the cognitive assessment in terms of IQ and DQ. As you can see from the graph, there is a marked improvement in the stunting levels, low BMI. There is increase in attendance just after 1 year of intervention, and the major findings after 2 years of milk distribution proved the sustained benefits of regular milk consumption. The absenteeism decreased progressively in the intervention schools from 36% to 23%. 72% of the normal height in the intervention was observed versus 64% normal height in the control schools. The children reporting any illness in the past 24 hours were less in the intervention schools as compared to the control schools. So it's 17% versus 23%. Now let us focus on the challenges which are there in the school milk programs. So the first challenge is the accessibility to remote areas, considering the perishable nature of milk and the vast geographical country we have. The milk is perishable, we all know, and reaching milk in the remote areas becomes a very costly affair, considering the requirement of longer shelf life of milk or maintenance of a cold chain throughout the distribution network. The another challenge which we are facing is setting up of a plastic waste disposable system for the pouches which we are supplying. The setting up of this collection system is a challenge considering the small quantities involved and also the geographic spread of the schools. Another challenge is making milk distribution cost effective compared to the school meals for large coverage of the children. The cost of a milk pouch per child comes out to be higher than the cost of milk provided as a part of the school milk programs. Nonetheless, considering the nutrient richness of milk its importance in a diet for the children cannot be denied. Therefore, the technological interventions would help to make a serve per child more economical. The last challenge which we have identified is a single institutional model through successful, though very successful, may not be universally appropriate. So India is a country, which has a large diversity, and it has a varied topographic, demographic, and socio-economic conditions. Thus, a single institutional model, though successful in one area, it may not be universally appropriate. And these are some of the learnings from our experiences. The educational and behavioral approach, though through the awareness programs, including the competitions like drawing, essay, quiz, etc., talks, informative posters, etc., helps reaching the benefits of milk consumption to maximum children. It also helps to increase the involvement of the children with the program. So building standard operating procedures, the SOPs as we say, at all levels helps in ensuring accountability of the stakeholders, including the timeliness of supply, quality assurance. As per the government regulatory authority, we'll have to maintain the standards of the milk being supplied, and proper handling, distribution and record maintenance by all these schools is another learning which we have from this program. Markers like anthropometric, bone or dental health or the status of nutrients, etc. are to be developed and regularly measured to understand the impact. Otherwise, the school milk programs, if you don't measure the impact, it will not attain the desired goals. And lastly, let me come to the way ahead. Inclusion of milk in the government safety net programs, such as the public distribution systems we have, it will support the livelihood to farmers and also the ensure nutrition for all. So micronutrient deficiencies is one of the major causes for the prevalent malnutrition. Milk can be used as a medium to make these macronutrients available as per the area specific differences. Currently, India has no standards for fortification of milk with either iodine or iron or zinc or fluoride. Thus, there are international examples which will help us in developing the standards for including these micronutrients in these school milk programs. Lastly, let me say that we want to assure that NDDB will continue to support and promote institutional structures and the arrangements for supporting these school milk programs and also ensure a better tomorrow for our children. Thank you and namaskar.
Will be very brief in my concluding remark. I want to thank you all participants for sticking with us, although we're a little bit over time. But just as you've seen today, school milk initiatives are well positioned to positively impact the dietary habits and nutritional status of children and adolescents. IDF survey provides you really unique insight into school milk program implemented worldwide and show us that at least 160 million children across 62 countries are benefiting from school milk program right now. These programs are also a great example of success of public-private partnership. As you've seen in those two videos, that there's a collaboration between often government, state level, local level, as well as dairy and farmers on the ground. Dairy is truly an essential service, and in these exceptional times of public health crisis, it's heartening to see how the dairy sector continues to ensure that our nutritious food get to this important vulnerable population. As you've seen in the US video, and as was mentioned when I'm calling from India, children are our future and we need to invest in their health. If you want to know more, you can actually download the bulletin on our website. It is free of charge. And stay tuned, because upcoming in 2021, early 2021, we'll be adding online school milk program hub. That will be an opportunity for sharing best practices and learnings and knowledge and latest science on school milk program. So we're very excited about that new hub, and it should be available early in the year, so we'll keep you posted on that. So I would like to wish you all a great World School Milk Day, and thank you for your participation. It was great to have you with us. Thank you very much. Thanks, everybody.